More than 50% students don't know the exact evaluation and management of a patient with hyponatremia. So if a patient comes with sodium level of less than 135, you first check the fluid volumes. So it can be hypervolemic, euvolemic or hypovolemic. A patient with hypervolemia will present with symptoms such as peripheral edema or ascites or increased blood pressure. So if there is hypervolemia, it can be a cardiac failure or maybe a liver failure or kidney failure. You can check the urine for that. So if the urine has increased sodium, this means it is a kidney failure, acute or chronic renal failure. And if the urine sodium is decreased, now this can be a cardiac failure or nephrotic syndrome or maybe a liver cirrhosis. What is the treatment plan? So first you restrict the fluids and the salt. But if the kidney is not involved in the problems, which means if it is a heart failure or liver problem, you can also go for diuresis to remove the excess fluid. Now let's come towards the euvolemic patient. So euvolemic hyponatremia is usually SIADH. So there is increased antidiuretic hormone which leads to increased osmolarity of urine. So basically a concentrated urine is being produced. But if you find that the urine osmolarity is not that much increased, it can be primary polydipsia or things like that. And the treatment plan is simply fluid restriction. So euvolemic hyponatremia is treated by fluid restriction. Now let's come towards hypovolemia. In hypovolemia, there will be dry mucous membranes and the blood pressure may be low. Now again, this can be simple dehydration which is caused by vomiting or diarrhea or burn patients or pancreatitis. But in all of these conditions, urine sodium will be normal or decreased. But if the urine sodium is high, again kidneys are at fault. This can be the use of diuretics or any other kidney problems. And since the volume and sodium are decreased, so you simply treat these patients with saline infusions. I hope you like the video and now you can solve this USMLE question.